All right, you guys, the first thing I want to talk about before we get into some of our GI representative conditions is dehydration in children. Kids can lose fluids in a lot of different ways. We can see water loss from the skin, respiratory, urinary, or GI tract, or insufficient fluid intake. Some of the things that we've talked about thus far are how kids lose fluids from fever, burns, respiratory distress, hyperventilation, DKA, hyperglycemia, and we're going to focus more on vomiting and diarrhea that comes along with our representative GI conditions. I'm not sure if I sent you guys this table that I made up, but I will email it again to you guys when I'm done lecturing. And again, this is just kind of a review of the charts that are already in chapter 41. If you look on page 1174 and 1175, you'll see table 41.2 and 41-3 or 0.3. Some of the information, just kind of condensing it into one page. So we look at kids with mild dehydration, moderate, and severe. Mild dehydration, you'll see a fluid loss less than 5%. The clinical findings, what they would look like with hypovolemia, mild dehydration. They're going to be pale, have dry mucous membranes, decreased skin turgor. Cap refill will be less than 2 seconds still. Decreased urine output. Pulse rate should be normal or slightly increased here, and their blood pressure, again, would be normal at this stage of the game. Some of your nursing interventions would be to weigh the child, and we want to monitor and record I&O, administer IV fluids at maintenance rate. We would want to keep the child NPO for 1 to 2 hours if they were vomiting. We want to rest the gut. And then what we do after those 1 to 2 hours is we start administering oral rehydrating fluids in small amounts. Once they tolerate those over a period of time, we will gradually reintroduce the diet and monitor the child's response to that. If we start giving them oral fluids and they start vomiting again, we stop, NPO 1 to 2 hours, rest the gut, start the chain all over again. And I'll go into these things in much more detail as I hit the representative conditions. For moderate dehydration, we'll see a fluid loss between 5 and 9%. As you can see, if you just look across the chart, the clinical picture starts to change. The color of their skin, they're now gray. Poor skin turgor, mucous membranes are very dry, cap refill is prolonged. Oliguria, pulse rate is increased. Blood pressure, don't forget with kids, blood pressure is one of the younger the kid especially, blood pressure is one of the last things to compensate. So we still could see a normal blood pressure here. Again, we would still want to weigh the child. We need to know where we're starting, and then you need to monitor I&O. What are we putting in and what's coming out? Administer IV fluids via bolus, remember 0.9, and we're going to give this 20 mLs per kg over 15 minutes. Then we're going to start the IV at either 1 or 1.5 of the maintenance rate. Kind of think back to our math module. We would still keep the child NPO here for 1 to 2 hours. And again, we're focusing on conditions that are causing GI upset. Gradually reintroduce oral rehydrating fluids in small amounts. If they're tolerating that, we can reintroduce the diet. And again, just monitor the child's response. For severe dehydration, we'll see a fluid loss greater than 10%. And again, the clinical findings, the picture here is much more grim. We see mottled skin, very poor skin turgor, parched, mucous membranes, extreme prolonged cap refill, oliguria continues, pulse is rapid and thready, and now we're seeing the blood pressure become lower. Some of your urgent nursing actions: assess ABCs, airway, breathing, circulation. Let's weigh the child. We're still going to monitor I&O. Again, we've got to give them fluids to resuscitate that hypovolemia. We're going to keep the child NPO for 24 hours. After that amount of time, we will start the oral rehydrating fluids, gradually reintroduce the diet, and monitor the child's response. Are they tolerating the oral fluids, or do we need to keep them NPO before we reintroduce the diet? All right, so that was just the chart. I'm going to send this to you guys, and then I will start lecturing on some of the representative conditions that we'll talk about.